This is our town. This is our home. And we love it here. But it's got its problems.
We all know people who have it hard. Family, friends, neighbors.
People who can't afford to get sick. Maybe they can't find a job. Maybe they can't even find a place to live.
All around us, families are struggling with homelessness, hunger, unemployment. Families who don't have access to basic healthcare services, who can't even afford transportation to see their doctors.
These are the root causes of health problems for our most vulnerable neighbors. And if we're going to build a healthier St. Louis, then all of us are going to need to work together. And all of us are going to need to rise up.
Any day of the week, there's over 1,000 people in this city who don't have a place to live. 1,000 people without heat, without clean water, without anything.
Lost my house and everything, and I started standing on the street and stuff until I got sick. I was in the vacant house, and I had a stroke and went to the hospital. And couldn't walk for 6 months, and I stayed in the hospital. That's when I met Emily. They helped me out in the hospital, and then Emily helped me get a place in a tiny house.
SSM's health partnership with St. Patrick's Center has greatly increased the number of safe discharges from SLU Hospital. It just increases a lot of accessibility and kind of reduces some of those barriers that folks are often facing in terms of transportation and money and time and things like that. So SSM Health has been great in their partnership.
Yeah, SSM, they helped me out. St. Patrick's Center is doing a lot for us. They helped me out with my therapy, and they helped me out working, and they paid me good.
Have you ever had to tell your kids there's nothing to eat for dinner? Have you ever had to tell them that every night for a week?
Nutrition's a form of medicine. People who aren't eating well, they need to be able to have access to foods that have protein, calories, and all the vitamins and minerals that are necessary for healing. People feel better when they eat better.
In the DePaul service area, the most recent data shows that 20 to 30% suffer from food insecurity.
So we'll have patients that will choose to either forego food or they'll go and buy the cheapest food they possibly can just to meet their needs. And that cheap food at times is not necessarily the healthiest food.
DePaul has partnered with Operation Food Search and St. Louis Food Bank in order to provide food for inpatients. So those patients are screened for food insecurity, and those that screen positive are actually given food to take home. They're also provided resources in the community to access additional food.
You do your best to stay healthy. You do your best to plan for the worst, but no matter how hard you try, you can't plan for everything.
Healthcare is not equal for everybody, fortunately. There are individuals that have difficulty getting the attention and getting the proper care that they deserve.
Right now, I'm going through a situation where I have fluid that's building up in my stomach and they don't know where it's coming from. You have to have some support to be able to get through what I'm going through.
You have to connect with people. If they have insurance coverage for their medicines, that's only one step. Most of our patients don't even have that.
And medications, some patients can't afford their copay. We're a medical home, so that's what I want our patients to feel welcome and loved when they come here. And that's important for the health. There's no greater privilege than to enter into the life of another human being, to be able to share with them their joys of health.
You guys are wonderful, wonderful. And hey, keep on fighting a good fight. There's somebody out here that actually cares.
These are just a few of the ways that SSM Health is working to build healthier communities by going outside our hospitals to where we're needed most, and by partnering with local service agencies to make sure the people we serve are getting the chance to live their healthiest lives.
In this place we call home, we're all interconnected. When you support SSM Health Community Health, You're helping people you see every day. Your neighbor, your child's teacher, your grocer, your family and friends, people you know and care about. So now's the time to rise up and make a difference in the lives of thousands of people through the power of our presence.
Rise up and invest in the people that make St. Louis such an amazing place to live.
Rise up and give back to your hometown.
Rise up and help someone in need.
Rise up! Rise up! Rise up! Rise up! Rise up! Rise up! Rise up!
Rise up and build healthier communities for all of us.